Welcome, my dear students, to a totally different class. I wouldn't call it a class, but rather a kind of introspection. On seeing my students, I feel sad. There is an imperceptible blend of anxiety, thesis, publication, examination, practicals, postings, and whatnot. Adding fuel to the fire would be my own venture of discovering questions for you people. In the bargain, I realized what futile an attempt that we, that is you and me, are putting in. Whether we will be able to reach the goal, we shall see. This class is exceptionally meant for the final year students 6 months away from the university exam. And I have called it challenges. Thanks to deposit photos, a beautiful picture, a landscape that is there. 6 months. This is the symbol for today's class. And these are the parameters that we shall be considering. Books. What books am I to read? Read your books. Fewer the number of books, better. You should have your own classical text for each division as it may be. But then, as is always mentioned, Robbins, Ackerman, Fletcher, or so, you find that these will be the basis. And you can add the hematology and the clinical pathology text to it. But fewer the books, better. Volume. As I had been mentioning, you find that there is a huge volume. I was just going through some of the series of questions. It will be disastrous for us to count the questions. But then I always tell my students, read, never look back. Do not try to analyze or recollect. You will be able to do them at the exam. Please follow this golden rule of mine. Never look back. Peer pressure. We used to have it during our student days, and also the students of the following generations. They all had them, but ignore them. It can be pressure from your seniors, expectations from your teachers, and so on. Parents, of course, we do ignore everything, but that is exactly what you people should. Slides. Try to see as many slides as possible. This is not for the diagnosis per se, but it is for you to develop a reflex and an intuition. However many slides you people see, at least 50% of the slides in your exam will be those that you have not seen. And each slide is unique in its own way. And in each slide, you find that each field is different. That is pathology. Don't bother about it. Develop the reflex and leave the rest. It shall follow. Not all slides are seen by everyone. In fact, when the examiners come and pour in their slides, we find that each has got his or her own collection. Time management. There are two things. One is managing the time that is with us 6 months from now. And the second one will be time management in the exam. These are two different components, but definitely very, very, very important. How do you manage the time? I would advise you people to kindly rehearse. Always you find that your first set of reading will be slow, interrupted, discouraging. And as you people gather pace and confidence, it shall come back to you. There are many such subheadings. I will not be going into it, such as reading, reciting, rehearsing, practicing, reciting, and so on. And finally, reproducing. Time management for the preparation. So this is a little unique. As I had been telling you people, some of the questions are not for us at all. They ask questions from the technicalities of the modern world. And also the amyloidosis, that was an age-old question even for us. So pathology does not being tailored according to the changing times. Therefore, what we should do is read in a one-way direction. That is one. Secondly, do not try to memorize. It is not possible. Only thing we shall be repeating. But as you listen to a class or read a set of notes, mark them. You are not marking it in the book. You are ingraining them into your head. And do it in such a way. Always, if you try to read the latest technologies or the recent advances, it will be very discouraging because it hampers your progress. At the same time, we cannot afford to compromise on the very basic undergraduate questions: anemia, pneumonia, atherosclerosis, so on and so forth. So I would advise you people very much to go through my R.A.T.S classes for undergraduates. You people are definitely beyond all that, but then for time, it will definitely be a weapon so that you are able to revise them very rapidly. Don't stop with that. After listening to the class, go back to the book. And that is the end of it. You know the topic. Because already you people are too very familiar. You have taken classes and you are an authority in it. Only thing we need some kind of a motivation and a confidence to be gained. So it has to be spread evenly. UG question, PG question. Hematology, general pathology. Recent advances, conventional questions. And technical questions, kindly read them. I know it is terrible. Those have been written by technicians, by technologists, by physicists, by chemists, by so-called the radiology and the nuclear physics people. And it has been put into our autopsy on various conditions such as septicemia, etc. So whether it has got a meaning or not, it will find a place in the question paper. Fingerprinting. So I would advise you people to kindly spread them uniformly. I, on my part, I am trying to do my work earnestly so that it reaches the students. University questions. There is no meaning in trying to read a book from cover to cover. Do not try to master pathology. That is your business in life, not for the exam. What you people should be doing is university questions. Be familiar with all the undergraduate questions as well as the postgraduate questions. And what do I mean by it? When I say university questions, I would like you to people to kindly choose two universities, any two university that you like or you have in mind. For example, I have put the Tata Memorial Hospital or the university, and then the MGR Medical University in Chennai, Rajiv Gandhi University, Karnataka, or any of the Pondicherry universities. Choose any two, and then 10 years of that. So you will be finding different patterns of question. There can be problem-based question, etc. Tata Memorial, it is purely applied. And then it appeared very difficult. But if those people were to write a test from MGR University or down south, they will have huge difficulty in answering the general pathology undergraduate questions. So it varies from place to place. Similarly, we will not be so very familiar with the technicalities elsewhere. So 10 years questions in continuity, 91 to 2001, or from 2001 to 11, or still better from 2010 to 2022. Choose a complete set of questions, arrange them chapter wise. This is important. Arrange them chapter wise and mark them in your books. It is your business to find out the answers for most of the questions in Robbins or any surgical pathology book or in hematology. So this will solve most of the problem. The other things we will have to take the notes or follow the classes such as R.A.T.S, etc. Beg, borrow, or steal from your friends and have a compilation of those. Recent advances. Always, recent advances are extremely difficult topics because they have been written by people who are pioneers in that field. A person who has written something about autopsy will not know anything about tissue microarray. Similarly, a person who has written something about electron microscopy will not be knowing about respiratory distress. They are all people who are pioneers in that particular field. Therefore, do not try to match yourself with them. It is a very futile exercise. On the contrary, even if you can write 25% of it, you are an excellent student. So for this, I feel that notes will be of great use. Time management for the exam. This is something totally different. When you get the question paper and you know that you've got about 3 hours time, how do you manage? How do you allot? Always I find that students have written the first few questions very well, and towards the end, it might even be an essay. They try to contain it within about 1 or 2 pages. So that is a big mistake to make. So what else am I supposed to do? Divide the total time by the marks. So if there is going to be 3 hours, it is going to be 180 minutes. And I will have to divide that by the marks. And if I got a 100-mark paper with me, that means for each mark, I will have to take about 1.8 minutes. Not more than, maybe a little bit here and there. Do not try to answer an essay question or a short note elaborately at the cost of an essay. Even if the examiner likes the answer, he is unable to give you too much mark for that. Common sense. Very, very, very uncommon. So common sense will be most important for us people. What do I mean? Most of the questions are repetitions. That is why I said, if you are going to go through 10 or 12 years papers, 50% straight away will be repetition in one form or the other. Therefore, repetition is the mother of knowledge even here. So go through the questions. The questions will take us to the answers. Common sense is very uncommon. Practicals. Practicals means it is supposed to be a hands-on exercise. Many of us do not do it. We try to memorize. There might be some difficulty for some particular exercise, but many of the things that are routinely happening in and around in the laboratory, you people should know. You should know that xylene, it causes a burning sensation. The stains, they will stain your hand. How to remove that particular stain, how to de-stain, how to restain, how to mount, how to get rid of the air bubbles, so on and so forth. What are the common mistakes? What are zebra lines, etc.? All these you'll be able to answer when you see the slides, do the work. In this case, I feel the laboratory and the technician are your greatest teachers. Reading is not equal to doing. Day-to-day procedures. Again, a repetition of what I have said. In many institutes, even in my own institute, I find that students straight away go to the slides. It is good in a way, but then you are going to be allotted marks for grossing, marks for staining, marks for special staining, clinical pathology, different types of hemoglobin estimation, blood grouping, Coombs test, etc. All these are not found within your slides. We are more anxious that the slides are the ultimate. This is a wrong decision in today's world of pathology exam. Marks are distributed across. Therefore, other fields also can fetch us marks. Day-to-day procedures you people know, should know, and routines matter most. Even when they ask a student question, they want to assess how student is confident about the exercise, whether he or she has gone to that place, done a work rather than the accuracy in your answers. The exam pattern. This obviously it will vary from center to center. I would like you people to kindly go through your exam pattern. Always familiarity means 25% done. So if you are familiar with the questions, your subconscious mind will calculate the time. It will decide what kind of questions are there. How many of the autopsy questions you get, how many of the procedural questions you get, what kind of recent advances. If your mind is tuned to it, it will save you a lot of time and put you in a zone of comfort. Of course, there are some pros and cons. When there are examiners from other centers, they might ask us in a different way. But then, basics are basics. This is what my JIPMA professor taught me when I was a senior researcher. Fundamentals are fundamentals. If you are strong in your basics, nobody can shake you. Fluency. This again comes with practice. Practice, rehearsal, and then you do it. Notes. Your notes will be the greatest Bible to be read, to be reproduced, to be possessed. Do not borrow anybody else's notes. Their mind will understand it, whereas yours will not accept it. As far as possible, try to have a half-page note of the question. It can be in skeleton so that you can reproduce. If it is straight away going to be from the text, write on the page of the book, or rather in the book itself, you can mention what kind of question it is. So your notes will be very, very, very important. And that will be the best tool for the university exam. And ultimately, what is the solution? Here, I am finding a pack of these watches. Fine. And you have got about 6 months more. How do I plan it now? Obviously, we will be changing the timetable very frequently, schedule very frequently, because we are not able to cope up with the previous one, and then we keep changing. But please do remember from now that time and tide wait for none. So do not waste a single minute. You people should be able to manage your thesis. Get rid of it as fast as possible. Your publications, get the help of the faculty, sit down with it, complete it, and throw it. And at the examination simultaneously. I know that there will be some centers which are harping on the presentations, the standard, and so on. That should be, you should be very clever enough. There should be a gradual decline in your attention towards it and more programming towards the university exam. In which case, you will be able to meet the challenges and follow R.A.T.S, racing against time for students. This, I hope, is an exercise or a good presentation, particularly for the students in the last 6 or 7 months of university examination preparation. I shall again revisit you people 3 months before the university exam, and let us see how much progress we have been making. Also, try to follow from whatever source it is. undergraduate or postgraduate. R.A.T.S will always help you. Thank you.